patient hold her breath and count to 3. Make sure the ball on the right elevates and stays between the ends of the bracket to ensure proper inhalation. After a deep inspiration, have the patient remove the mouthpiece from the mouth and exhale normally. Have the patient rest for a moment, then repeat the exercise about 10 times. Repeat these steps hourly throughout waking hours. If at any time the patient begins to cough, encourage to remove secretions from the lungs. Offer tissues as needed. Rinse the mouthpiece with water. Label the unit with the patient's name and store in a clean area with easy accessibility. The overbed table works well. Assist the patient to assume a more comfortable position and tidy the area. The gastrointestinal system is another system that is impacted by immobility. This system includes the mouth, the esophagus, the stomach, and the intestines. Lack of mobility slows the movement of food and waste material. This can cause a person to have a loss in appetite, or it can add unneeded weight due to lack of exercise. It also can cause constipation and possibly a fecal impaction. A fecal impaction is a blockage of stool. This prevents the passage of further fecal material, resulting in abdominal pain and bloating. Measures that you, the healthcare assistant, can take to help prevent this are making sure the person is as active as possible and encouraging the patients to eat more foods that are high in fiber and roughage and low in fat. And also encourage the adequate intake of fluid. It's recommended that we drink between 8 and 10 glasses of water per day. That's not always advisable for patients that have medical conditions that may prevent that from being a good idea. So before you push that amount of fluid on your patient, be sure to check with the nurse. The urinary system is another system impacted. This system includes the urinary tubes, the kidneys, and the bladder. Lack of mobility causes urine to pool in the kidneys rather than drain by gravity down the tubes into the bladder. This stagnant pooling urine is a perfect harbor for infection and kidney stone formation. Ways to combat these problems are making certain that the person is as active as possible and encouraging the patients to drink adequate amounts of fluid. By doing so, they will be able to flush the bacteria and minerals such as calcium out of their system. The last system to be discussed is the neurological system. This system includes our mental functioning and our sense of well-being. Patients that are inactive become very stressful. It can lead to frustration and lowered self-esteem. Immobility impacts a person's thinking ability. It impacts their lifestyle and social and family responsibilities. It's also a source of depression and a sense of helplessness. In closing, the most important message to take away from this videotape today is the importance of patients staying as active as possible. You will care for many patients that are immobile or have problems with moving. Many of these patients are going to resist your efforts to move them due to pain, fear of falling, or other reason. You, however, have a very important role to help patients understand the importance of moving, even when it's uncomfortable to do so. The prevention measures that you take while caring for patients will help ensure that the complications from immobility will not occur. Thanks so much for your attention.